My name is Kiran Martin. I am a pediatrician and a family physician. I am from the 1977 batch of Maulana Azad Medical College, Delhi, India. I began a charitable organization called Asha for the residents of the slums of Delhi in the year 1988. Asha works in about 100 slums covering an approximate population of 700,000. The work we do is in the areas of healthcare, environmental improvement, education and women's empowerment. This is a special update for physicians on the situation with regards to COVID in the slums and the interventions Asha is making. These interventions have been made possible through the advice given to me by a number of brilliant physicians, my friends from Maulana Azad Medical College 77 batch, other physicians from the UK and the USA. Many of you have made generous donations from India and all over the world, for which I am truly grateful. Of the total population of about 18 million living in Delhi, about 5 million live in shanty colonies. Now, how has COVID affected these slum residents? There are hundreds of patients of varying degrees of severity in the slums. It is impossible to get accurate data because of the paucity of tests as well as the social stigma attached to the disease. Social distancing and isolation of patients is impossible. Masking is uncommon inside slum communities. The pandemic has driven these communities into poverty and destitution since they are mostly daily wage earners with no work. Stigma and ostracization is a major issue, with families often being forced to leave the slum. There is immense fear and anxiety when they watch television and see the horrendous images. Now, what are Asha's interventions? Asha has a team of doctors, nurses, paramedics, health workers and Asha Corona warriors operating through a combination of our 15 health centers and our mobile vans. The Asha Corona warriors are young Asha students who are local residents. All have been extensively trained in COVID protocols. The cases are divided into mild, moderate and severe through triaging. Mild patients are treated using a standard Asha protocol. When it comes to moderate patients, we go by counting the number of days rather than the SpO2. We start by counting the first day of appearance of symptoms. If the patient gets worse or does not show improvement by the 6th or 7th day, we give them steroids, we nebulize them with budesonide, we also add anticoagulants and give them supportive treatment. They are very rigorously monitored for their vitals, for their blood sugars as well as for other parameters. When it comes to severe patients, these are patients who have been completely refused hospital admission. As you all know, there is a real crisis of beds and oxygen in hospitals, and so as a last resort, when they come to us and are willing to accept whatever form of treatment we can offer, we treat them at home. We now have oxygen concentrators thanks to our wonderful friends in the UK and advice from friends in Delhi, and we provide them with treatment right in their slum home, even if they are critically ill. The success rate for the treatment of moderately ill patients going into severity has been very high. We are unable to do blood work or other investigations, and therefore we are relying on the symptoms and signs. There is rigorous monitoring done of vitals and blood sugar, and the best part is that it is accompanied by attentive and compassionate care and the support of family members. With regards to prophylaxis, there is dissemination of critical messages by the Asha team and the warriors. There is mass distribution of masks. There is the provision of injection vitamin D3, 6 lakh units intramuscularly to all those who are 25 and above. The separation of toilets for COVID-19 patients is something that all our team members and warriors do. They also try to make sure that there are no crowds at water points when the water comes and people come to fill their cans and buckets. We are also dealing with community members to explain to them the nature of the disease in order to avoid stigma and ostracization. With regards to vaccinations, the good news is that all Asha team members and warriors have been vaccinated. However, you may have heard that there is a shortage of vaccines in the city, and so therefore we are trying our best to vaccinate community members, but have had limited success. There are also myths and superstitions that are associated with the vaccine in the population. We also giving grocery parcels to extremely needy persons who are suffering from destitution and starvation. I personally visit the Asha communities regularly, and I think that's really important in order to inspire and motivate my team. 700,000 is a huge population to cover, and we are going to all the slums that we were already working in, but we're also going to many other large slums that we've never gone to before. So I want to just convey my heartfelt thanks to those who have made contributions, and I hope that the medical fraternity all over the world will be able to come together and help my team and I in our efforts. To donate, please go to our website asha-india.org, that is asha-india.org, and click on the donate button on the home page. Donations in kind for those who live locally are welcome and can be dropped off at our headquarters. There are links given in the description box for all those who require any further information. It is my hope that you can reach out to your networks of healthcare professionals everywhere and help us save lives. Thank you.